So, what happens when you're diagnosed with cancer? What's the next step? Well, usually what happens is when an oncologist gives you a diagnosis that there's cancer presence, then they will offer their recommendation as to what kind of treatments you will receive. And at that point, you're either going to accept that or get another opinion somewhere because what you're thinking at the time is, okay, so I'll start chemo treatments, or I'll start radiation treatments. What's going to happen? Because I've heard bad things about them. Well, I'm going to give you a typical picture of what I see in the real world because I am always working with cancer cases and I'm an integrated practitioner and I use the RGCC system in terms of creating a personalized cancer therapy. So usually an oncologist will provide the recommendation, but it's based on criteria that they follow and it's multi-layered in their decision process, integrating tumor biology, patient factors, and evidence-based guidelines. And so an example for tumor biology is they have to have the biopsy information from histology in order to know the tissue of origin, where it came from. For example, the tumor type might be adenocarcinoma or squamous cell carcinoma, and so that helps to narrow down their therapeutic options. And then they also go with biomarkers, some predictive biomarkers like HER2 amplification for breast cancer. If someone is HER2 positive, uh, a, a therapeutic drug that's targeting that would be trastuzumab or Herceptin. For someone with lung cancer and they see that there's EGFR mutations, then it would be osimertinib, and that's the targeted drug that will inhibit the receptor for EGFR. And so those receptors are what is also involved in driving the disease. So they're going to use a targeted drug to block that receptor and therefore stop the cancer from progressing. Now, there are also uh, criteria that is followed based on FDA approved tests, and that in order to prescribe a certain drug, they have to go through this FDA testing. And also, when it comes to evidence-based guidelines, there's the NCCN guidelines. That's the National Comprehensive Cancer Network, and they have a set of guidelines that will determine what's the drug of choice for this type of disease, and that also is uh, determined by levels of evidence, such as randomized clinical trials, randomized control trials, meta-analysis, and observational data. And these help them to be able to come up with a specific drug of choice. And then there's the patient-specific factors. Performance status is a big one, which we have a couple of functional capacity tools, such as the ECOG scale or Karnofsky index, that determines if a person is eligible for treatments. And anyone with, for example, with a poor performance status, such as an ECOG score of 3 or greater, would be ineligible for aggressive cytotoxic regimens and may be steered towards more of a single agent or best supportive care. And then there's also the comorbidities and organ function. So someone with a heart issue or uh, liver problems or kidney problems, disease that were pre-existing, that would also determine eligibility and will also may have a dose adjustment. So those are things to consider as far as what oncologists will use to select a specific treatment modality. And then there's also the age factor and their frailty. And if a person is late in the age and they don't have very much physiological reserve, or they're very frail due to the disease uh, progression, that's going to affect the type of treatment regimen that would be recommended or appropriate. And then, of course, the patient's preferences and goals of quality of life, that also will be taken into consideration. And so it needs to be a shared decision making. And then, as far as a drug specific consideration, there's the cytotoxic chemotherapy, there's the targeted therapy, such as the monoclonal antibodies or immunotherapies. Those are targeted therapies. And then you've got the hormone therapy that will inhibit the hormone receptors that the cancer is dependent for growth. And so those are considerations depending on the type of cancer. And then, of course, if a person has a prior history of treatment, they may have already developed resistance, and so that will also change in terms of the type of drugs that may be recommended if it was a recurrence or someone who was in remission and the cancer came back. So they have to take that too into consideration. And also, some people are uh, easily get toxic, and there's very bad side effects, and so they have to look into that. The risk benefit ratio, it must be favorable in order for them to uh, start on those type of treatments. And then you have also the more emerging advanced information in terms of tumor microenvironment and metabolic uh, therapies. And then, of course, you've got the RGCC system, which is essentially a very science based data gathering test that will look into the blood, and being a liquid biopsy, it will look at the circulating tumor cells. When they detect that, they're able to determine if it has aggressive behavior based on their markers. And we're looking at their risk for resistance, recurrence, metastasis. That will affect decision making too, coming from the RGCC practitioner. And then we will also be able to determine the sensitivities of the agents, whether it's drugs or natural substances like melatonin or vitamin C. Those are all tested, uh, about 150 plus agents routinely from whole blood after they harvest the cancer cells, and then we are able to perform culture and sensitivity testing and gene profiling of these cancer cells. We're able to know what will work in advance prior to administering them, prior to getting treatments. And so that is what the RGCC system provides. And on top of that, we'll also know their gene profile that determines which uh, metabolic pathway that the gene encodes is being used by the cancer cells for proliferation. And that, knowing the pathway, then we will be able to select agents that will block those pathways, and that increases the coverage for cancer therapy. And combining that with the standard oncology care, hopefully those drugs that are chosen in oncology also show high efficacy, since they are also tested routinely in RGCC testing. Uh, that will provide the comprehensive coverage, since cancer cells are constantly mutating. They are wanting to resist and escape from being completely destroyed, the great coverage of the RGCC system will have the ability then to have better outcomes in stopping the disease from progressing or decreasing it significantly. And oftentimes they may even go towards a remission level, even advanced cases. So that's what a person today in advanced technology today has that opportunity to to choose the direction that they want to go in terms of cancer care. And following just the conventional approach is just part of the big picture, which includes nutritional, holistic therapies that also show high efficacy, since lots of many of these agents are also tested routinely. So combining both systems gives the best outcome. I hope that answers the question. You don't have to be afraid. There is help. It can be addressed effectively with increased survival and improved quality of life. So I hope that helps.